Do you know what acupuncture does? Do you know anything about the history of acupuncture?
A little bit. I mean, I know that it has to do with energy, and you have to have needles put in your body in different places. So
It's an ancient art, but it's a science, and it's very, very effective. The way it works is by, of course, placing metallic needles in the body, and we are a body electric. We're an electromagnetic being, and these needles send signals through the body, and it basically awakens a natural blueprint that your body has innately, and your body knows. And so the needles effectively help you to connect with the part of you that is your natural healer, that knows the balance, that knows how things function. And each needle is placed in a particular point that has actually a spirit name. And so when we take a history, when we think about how we are going to approach this patient, it's unique to the patient in that we think about these spirit names and how this patient has been fractured or hurt, or on a physical level has, pain in a certain area of the body. And so at that point we know where to place those needles, and that is what your body needs in order to reconnect with the natural blueprint that you were innately born with.
Okay. And how young can a person start receiving acupuncture?
Oh, sometimes babies can run fevers. I've certainly treated a lot of babies, children. Children can get very sick in life, and acupuncture is very effective for pediatrics. Through puberty, the stress level today in the children and the teenagers is very high, and I certainly treat a lot of teenagers very effectively.
So you talk about connecting everything, so somewhere along the way there was a disconnect because of situations or...
Stress. 99% of all illness is stress. So some level of stress got into that person, into yourself, or anyone that's displaying symptoms or has a disease state.
So would part of this also be learning to manage your stress along with...
Sure.
Or reduce
absolutely.
your stress along with the acupuncture?
Sure. Sometimes the stress even belonged to somebody that you were with, a boss or a parent, and you take it on. So of course, yes. Okay. Yeah. Do you have any questions about how acupuncture works, or do you know about it?
I do, actually. I just know that there's needles. I've heard some people say it doesn't hurt. Some people say there's a little sting. But then they say it's all over the body, different places, for different problems. I'm a little nervous about how it's going to feel, and
Well, here in California, we're well trained. It's 6 years of school to get the license.
Okay.
And we have a clinic that we see a lot of women that come into our clinic. So, yeast infections is commonly treated by acupuncturists, so we have a lot of experience with that.
Okay.
And as for the acupuncture needles being something that you might be uncomfortable with, they're very thin. They're the size of a hair. And when we insert them, we usually use guide tubes, so it's really relatively painless. The one thing that you do feel is you'll feel a distending, kind of achy feeling when we get what we call chi at the end of the needle. And we need to do that in order to move the channel energy, which is basically what's going on with acupuncture, is that we're inserting needles in the body related to the nervous system, but not entirely part of the nervous system. And what happens is when it's like catching a fish on the line when you're out fishing. You feel that tug initially. You'll feel that after I insert the needle. You'll feel kind of a distended.
Pain, so it won't be really pain.
It's different. You have to educate yourself. At first, it'd be unfamiliar, and so you might want to rush into thinking that, oh, is this painful? Well, no, actually, no.
Okay.
So you get used to it, and it's kind of an achy feeling. And that's what we want. If we don't get that, then we're not really giving it a treatment that could be as effective as if we do get that.
Okay.
And sometimes some needles are more guide needles, so we need to get the chi effect at that needle more than, say, another needle.
Okay.
So
how deep does it go? Is each one different?
Every situation, calls for a different kind of size needle and maybe a different depth. So
Okay.
we're going to put them in a way where they don't even break blood vessels. because they're rounded at the tip. They aren't pointed like a hypodermic needle. So when they are inserted, it usually pushes everything out of the way in the way that we insert them.
And how long for each treatment? Like
About 45 minutes.
okay.
Yeah, sometimes we retain the needles for 30 minutes, but usually about 45 minutes.
Okay.
And we try to use as few as possible.
Mm-hmm.
So, we don't put a lot of needles in. Maybe 6 to 8. That's about it.
Okay. Okay.
Okay.
I do have a question. Why do the over-the-counter treatments, why, in your opinion, or in your expert opinion, have they not worked?
Well, I think
And do they work for some women?
I think that they do work for some women. Some women just have, they can have an issue where, they just got married and, honeymoon syndrome or something, or, they took antibiotics and they never really took antibiotics and they developed a yeast infection. Some women go on birth control pills, and the birth control pills are something they're not used to and they develop one. There can be varying reasons. Maybe it's very hot and they're wearing the wrong kind of underwear. There can just be a lot of issues.
Okay.
And so for somebody with a chronic one, it's usually more of a systemic problem. And it's related to stress, and it can be kind of a psycho-emotional issue, or it also can be just the way somebody, is just operating their life. And, they might have more of a sympathetic reaction to life.